So it's all yours, Brett.
All right, Gary, Cheryl, thank you very much for the introduction. And Wendy as well. Thank you for having me. Everyone, this is a great turnout. So I'm very excited to be here and to talk to you about some of the basics of home care, which is what we do at Assisting Hands every day. What I'm going to do really quickly is try to share this and not have it mess up my screen too much so I can find all the windows. So let me. Do you all see the,
Yep.
okay, you see the screen? Okay, perfect.
Yeah.
Now I'm going to turn it into presentation mode. Okay, so you do see
Oh,
that now.
no, it's gone now.
Okay, hold on one second. Let me try that again.
There we go.
Okay, got it. Okay, you do see it. Okay,
Yeah.
all righty. And let me get you guys back so I can see the group. Okay, we are squared away. So just a little bit about me first. Again, my name is Brett Sanders. I'm the owner of Assisting Hands Home Care. I'll briefly talk about my reason for starting Assisting Hands and kind of where we got to the point of where we are today. I'll talk about some of the just basics of home care, and then I will answer any questions that you guys have, because usually there's a lot of questions on what agencies like us can do, how we help people, and just a whole host of other questions. I'm constantly working with clients that are navigating any sort of health challenges. So I can also provide some guidance on other things beyond just home care, and I'm happy to go into some of those topics. And if I get above my skis, I'll certainly tell you. I may not be the best person to answer those questions, but I can certainly point you to someone who can. Um, but I started Assisting Hands in Arlington in 2018. I had a prior career primarily in accounting and finance, and I didn't really feel a connection to that work after about a 20-year career. And one thing that had always I had always been interested in healthcare, serving people, and I had a very close relationship with my grandparents. I was a caregiver for my grandfather after he had a stroke. And I also really watched my mom be a caregiver for her mother, who had advanced dementia and had a decline over 10 years. So I had seen a lot of the challenges that people face as they age at a very young age. And it always left an impression on me. And I really wanted to take my career in a different direction than accounting and finance to do something that I felt like gave back to the community, and I could see the benefits of what I was doing on a daily basis. And I certainly achieved that in Assisting Hands. So we started in 2018. Towards the end of that year, we were licensed in October. We operated for the entire year in 2019. You may realize there's a lot of home care agencies out there, so it's a very competitive business. And when you're just getting started, it's hard to differentiate yourself. But I managed to get a lot of really good experience in 2019. And then in 2020, we all know that something called COVID happened. And, that really um, caused a number of hurdles, but I think it also increased the need for companies like us and the work that we were doing. And we've continued to grow over the last 5 years from 2020 up until now. And when I initially started, I was covering just Arlington. Now I cover all of Arlington, Alexandria, and all of Fairfax County. So we have a lot of clients that we service in that area. Um, and that's just a little bit of information about our agency. I personally am a certified senior advisor. I'm a certified dementia practitioner. I wanted, as I was transitioning and trying to get more experience in the healthcare arena, I realized that I really needed to focus on education. And so that was, something that I really did when we were first getting started in those early years, and it continues to help in the clients that we serve today. Um, I'm going to talk very quickly about what is home care and just give you a few pointers on some things that are often questions that we get. And then if there are any questions in the chat, I can certainly pause as we go through this just to make sure that we're answering questions as we go through this conversation and not just waiting until the end. But when I'm talking about home care and the work that we do, I'm talking about non-medical care. So, one of the first things that people always ask is this covered by is this covered by Medicare or any other health insurance? And the answer is typically no. There could be some changes in the coming years, but right now, the services we provide are 99% not covered by health insurance. And the reason is because it's non-medical care. So it's non-medical personal care. So that's typically called activities of daily living. That's your bathing, dressing, toileting, managing incontinence, if that's an issue, and a lot of the personal hygiene habits that we all have on a daily basis. Um, we also do a lot of household support. So that's your basic housekeeping, light housekeeping, laundry, meal preparation and cooking, and the activities that you do to maintain your daily activities in your home. And then there's a whole host of miscellaneous things that we do, um, helping to get people to and from appointments. We can certainly work with recommendations from a doctor to manage a plan. So we have for clients that might be diabetic, we certainly can try to make sure that they're compliant with their blood sugar recommendations. We can help with exercise reminders, help with drinking fluids. So a lot of our clients will get recommendations from a healthcare professional, could be a doctor, could be a dietitian, could be another home health agency, that a PT that might be making recommendations. We can provide support in any of the areas that they need it regarding those activities. One of the first choices that people have when they decide, okay, I think I do need some support, is do I hire private caregivers or do I hire a licensed agency? And the one thing that I can tell you is typically a private caregiver is almost always going to cost less because you're basically paying someone directly to provide that care. Um, Currently, the rates that people are charging for like a private caregiver might be anywhere from $20 to $25. Whereas if you look at a home care agency, it's going to be somewhere in the mid 30s to the mid 40s at an hourly rate. Um, so I always tell people we can never compete with a private person on cost, but I feel like we do provide a lot of value that they aren't able to provide, and I think the value exceeds even when you look at the total cost. For one, we're licensed by the state of Virginia, and there's obviously a set of rules and regulations that we have to follow that are all focused on making sure that we're providing good care in a safe environment. Our care plans are all overseen by a registered nurse. Um, the caregivers certainly are insured, credentialed, and vetted by us, and we have very high standards for the people that we're employing. But we're also doing things that an employer would do around payroll taxes and other things that have to be paid to the government. Um, Also, we mitigate any risks around injury, and those don't apply if someone hires an independent person. There's certainly greater flexibility as care needs change. We can increase a schedule, reduce a schedule. We often reduce schedules, by the way. I should point that out because we're helping people. Typically, a third of our clients are just coming home from a hospitalization or from a rehab facility, and they may need a high level of care initially, but we can phase that out. And ultimately, once they're fully recovered, they no longer need our support, and that happens all the time. So there's a lot of flexibility in the care duration and the activities that we can provide. And then, of course, there's peace of mind that comes along with hiring an agency, especially when it comes to substitutions or if someone is going away on vacation or sick. We can always provide a replacement. So those are the things that I point out, because again, initially people are deciding, oh, okay, we do think that we need some support, or I have a friend that needs support, or a loved one that does. Um, should we hire someone directly? Or should we hire a licensed agency? And I just like to make sure that people are making the most informed decision from that perspective.
We had a
I'm going to
question
pause.
here about
Yeah.
uh, somebody wanted to ask you to expand a little bit about private care. How does that work? How do you find somebody? How do you know that there's somebody you want to hire?
Yeah. So in that case, if someone does want to just hire a caregiver, you can go to places like care.com. Most of the time I see, and believe me, I have seen some good private caregivers that are out there. They're often hired through word of mouth. Maybe an aide had worked for another family that you trust very well. Um, there's a variety of places that you would go, and those are, either online or word of mouth. Um, so that's primarily where I see people going to make those hires. Does that answer the question? I mean, is Gary, was there more to it than
Yeah,
that?
no, I think that and your other comments have answered it. But in the meantime, we've got another question. Do you have strategies for getting a person who's resistant to having help to consent to it? She's got a sister that needs services like house cleaning and the like, and she's resistant to having people come into her place because she misplaces things and then accuses them of stealing from her.
Hmm. Yeah, yeah.
So,
So those are certainly challenges that we face on a regular basis. Well, let me get back to that question, because I thought of one other thing I wanted to mention about the prior question. I'm just going to contrast. I mean, when we're hiring, we hire, certainly, we post ads and people come in. There's a pretty extensive vetting process that we put people through. We obviously do background checks. We do a Virginia state background check. We also do a nationwide background check. Um, but the biggest, I feel like, vetting that we do is we bring everybody in for a personal meeting. We don't hire anyone. Even during COVID, we had people come in one at a time. But I feel it's very important to actually see someone, observe how they interact with our staff when we're hiring them. And we're asking ourselves, on every single person that comes in, would we have this person take care of a family member of ours? And we're observing their behavior, nonverbal behavior. Were they on time? How were they on the phone when they had a phone interview? So so many different factors. Do they seem compassionate and professional? Those are the most important things that we're looking for. And ultimately, we make a decision. Would we have this person care for a family member of ours? Yes or no? And if it's not a yes, then it's a no. So I just wanted to say that's a hiring caregivers is probably the most important thing that we're doing to make sure that we're providing high quality care. So that's just very important, and that's something obviously that a licensed agency does. When you're hiring privately, you have to do whatever due diligence you feel is appropriate. Background checks can be run online, but they're not easy to do. Again, there's a lot of work that goes into that, and you never fully know the person. But we try to take as much of that burden on. So that's one of the benefits of working with an agency like us or others like us. Um, the question about when you have somebody that's resistant to care, I wish there was a silver bullet answer to that. There's not. And that's one of the biggest obstacles that we face when we're working with people. Um, I'd say about 50% of our clients are willing to accept the help, and it's no issue whatsoever. And generally, in those cases, it's because they recognize that there is a need. The challenging part is when someone doesn't recognize the need that maybe other loved ones see. Oftentimes, that's um, not only compounded, but it is in combination with someone having some form of cognitive impairment. It could be mild cognitive impairment, it could be full-blown dementia, but they don't realize that they're not bathing on a regular basis. They don't realize that they would forget meals. And it's very hard to, I think in each case, what I do today is we take the time to understand the client's needs and the client's personality and the client's unique situation, and that input comes from a family member, and we work with that family to come up with a strategy for how that's going to work. It usually starts with a meeting. And most of our clients will start with a meeting with either me and or in combination with one of our registered nurses. We have to do an assessment in order to get started. That's how we ultimately determine what the care plan is going to be. Um, but we usually go into this as a meeting to try to get a positive meeting and positive interaction with us first. And then we'll try to get somebody to understand that, you know, if we brought somebody in, could we bring them in for just a few hours to, perform a couple of activities that they might agree to? And generally over time, we're able to work up to the level of care that that person needs. They may need 6 hours a day, 5 days a week, 7 days a week, depending on whatever other support they have access to. Um, and they may truly need that, and the family's telling us we have to get this put in place. They may only be willing to accept 2 to 3 hours, but I feel like if we can get in there for 2 to 3 hours, um, and then extend that each day, especially the most important thing that we need to do in this case, not only is to get off on a very good first impression, but we have to find the right caregiver match that's going to be engaging, that's going to really embrace this relationship that they need to build. And if we do that, we're usually able to get over the hump when it comes to someone's resistance. Any other questions?
When hiring from an agency, is there a minimum number of hours the person's required to be in someone's home? And if so, how does the worker fill up that time if there's not enough work to do for the required number of hours?
Yeah, so we do have a minimum number of hours. We have a minimum number of 4 hours in any one visit, and then we have a minimum number of hours per week, which is 20 hours. Um, the reason we do that is because there has to be enough of a need for us. One of the things we're trying to do is we're trying to find a consistent person to be that caregiver. Anything less than about 40 hours a week, we should be able to staff a client's case with just one caregiver, especially if it's just 5 days a week. So it's a very common request for us to get. Um, we want 4 hours per visit, 5 days a week, Monday through Friday. We either want to take the weekends off, or we have family members that are providing support if it's needed on the weekends. So um, 4 hours, 5 days a week. That's the 20 hours. Very common request that we get. Um, we need, I want to only staff it. I don't, some agencies will say, okay, we're going to have one caregiver on Monday and Tuesday, another on Wednesday, another on Thursday, Friday. We don't do that. Um, I'm looking to place one caregiver to be the primary person. That's what the caregivers want, and that's what the clients want. So they can get to know one another, they can build that relationship. The caregiver is very familiar with the care plan. They know the client, they know where things are in the home. So many good things happen when we have one consistent person. In order to get a consistent person to accept the assignment, we need to have a certain number of hours. That's why we've got the 20 hours. That's not a hard and fast rule. Certainly, there are some clients where we might do 16 hours a week, but that 20 hours is a good gauge of enough care needs where the clients are going to value the service. We had a lot of people that would say, "Oh, I want one day." We would find someone to do just one day, but then the clients weren't really committed to that because the care needs weren't that great. There's 168 hours in a week. They would only want 4 hours for that one time, and I found that we would work with them for a few weeks, and they would say, it's really not, what I think we could do without. And so it just started to occur to me more that there has to be some set care needs that someone has in order for it to work um, in order for us to be able to assign someone to that.
Okay, we've got more questions. Are there any competency or training requirements that a potential caregiver must have before you hire them? You talked about interviewing and vetting, what do they need to be able to do?
Sure. So we're in some of this. This is spelled out in our state regulations, but we have to hire somebody in order to provide personal care. So that's any hands-on care. We have to hire either a CNA, which is a certified nursing aide, a nursing aide, a personal care aide, or a home health aide. And in each case, um, it's someone that has taken a course on providing personal care. Um, the distinction is a CNA actually maintains a license with the state, and a nursing aide has taken the same level of training as a CNA. They just don't maintain an active license with the state. Um, I would say about a third of our um, caregivers that we have are CNAs, about a third are nursing aides, and about a third are the other aides that I mentioned, a personal care aide and a home health aide. And they have just taken fewer hours in the training course, but the state of Virginia still recognizes their certification as a valid certification to provide personal care. And the things that they're learning in those courses are all aspects of non-medical care, like how to give a bed bath, how
Unknown
to
caller.
how to provide the personal care that we're doing for people on a daily basis.
Okay. Next question is, if one has been discharged from the hospital or rehab, but requires less than 20 hours a week, can they still hire you guys for temporary assistance? Or
So
is
we're
there a
happy.
strict minimum?
So we're happy to work with people on a temporary basis. So that's kind of part number one. If we are getting started and we know that it's only going to be 2 weeks or 3 weeks, that's not a problem. We work with people all the time that with that sort of timeline. Um, the 20 hours a week is a not a hard and fast rule. It's not like if somebody says I need 16 hours a week, we don't automatically say no, it has to be this. And also, we don't bill people just for 20 hours, even if they, say I'll take less. Or if they cancel a visit. Let's just say we do have a 20-hour a week client, 4 hours a day, 5 days a week. They cancel Friday because they've got doctor's appointments and they don't need the caregiver that day. We don't charge them for that. We're actually charging just on what we actually work. Um, I'd say that each conversation around less than the 20 hours, we have to approach on a case by case basis. There could be a chance that we've got a caregiver that has availability on those days. And if so, we're absolutely happy to help. Um, One example might be if, and then we had this happen this past week. One of our clients went away on vacation for a week. They have roughly 20 hours a week, and that their caregiver was still wanting to pick up hours. They are only able to work a part-time schedule because of their family situation. So we took on a client just for 1 week that needed help, just almost exactly like the situation that was posed in the question. So we certainly can do that, but I can't guarantee that we're always going to be able to meet the need. It depends on what the activities are. It depends on what hours, if there are some specific hours that have to be met. So we have to approach that on a case by case basis.
Okay, the next question is, if you have a caregiver that's doing 20 hours for one client, would they then have a second client that would allow them to get up to 40 hours a week?
They could. Um, we hire we hire people. We hire part time people for sure. And I alluded a second ago to the case that I was using as an example where the caregiver has limitations because of their family situation where they can only work kind of in the middle of the day, like 9 to 3-ish. So we absolutely hire part-time people that work anywhere from 20 to 25 hours per week. Um, and then we have a lot of people that will try to work 50 or 60 hours a week if we'll give them enough visits to work with a client. Um, so we, I try not to rely too much on stacking schedules because care needs change very often, and clients will certainly, if we have a short-term client, it may work for 2 weeks, 3 weeks, 4 weeks, but often one of the client's care needs will change. So what we're trying to do most often when we're matching a client and a caregiver is we're trying to have a one-to-one match to the best of our ability. Um, if we do have two clients that seem like they're going to be a long-term client and the schedules work perfectly, one wants something maybe from 8 in the morning to 12 p.m. and then the other wants something from 1 p.m. to 5 p.m. and I've got a caregiver that wants to work 10 hours a day, then we may make that work and it could be a long-term fit. But we are more often than not assigning one caregiver to one client, and we I avoid stacking client schedules because things change so often.
Okay. Next question is, what is typically accomplished in a 4-hour window?
Goodness, that's a very open-ended question, and it could be there are so many different ways to answer this that the best way I could say is it really depends on what the client's needs are. Some people hire us to work 8 a.m. to 12 p.m. And in those cases, we're often getting someone dressed. We're helping to get them started for the day, maybe a breakfast, maybe go for a walk and exercise. Also, if the I find that the lower the personal care needs are, the more we might be doing some of those other household activities. Um, so we certainly can accomplish some of those assistance with light housekeeping, laundry. I alluded to the cooking, breakfast or meal preparation. That could be very different from someone that needs support later in the day. So we are coming up with a care plan for each client, and that care plan is a living document. It changes, and we reassess it all the time with the client on a continuous basis. And whatever the client's needs are, we're going to come up with activities from those buckets that I mentioned earlier. I'll go back and put the slide on. Um, so personal care, household support, and miscellaneous other. We will work with the client to determine what needs to happen in those 4 hours. And sometimes I get this question a lot around, gosh, 4 hours is a long time.
Yeah, right.
I don't feel like they're going to have much to do. There's going to be maybe an hour of work, and then there's nothing else for the next 3 hours. That's rarely the case. Um, and I would never want to sign up for a the responsibility or have someone's care plan comprised of 1 hour's worth of activities and then 3 hours of nothing. We will work with the client to figure out how we can provide support and value to them for the entire time. And if we can't, I think then we would have a realistic conversation of, are we really the right fit? Do you really need home care at this time if you only need, a small amount of support? And just I should have said this at the beginning. One of the reasons why I'm such a big advocate and I really appreciate the community that you have and just the broader village movement is the supporting one another, but also some of the activities that are done by volunteers. I'm often sending people to villages when they ask us for something, and I can tell right away that the care needs are not going to be extensive enough for us. that's when I recommend joining a village and try to educate them on that, because some of the things that could be done by volunteers to save someone money and to get them the support, especially if it's only a periodic need. I think the work that you all do really could benefit someone.
You talked about providing transportation services to doctor's appointments and things like that. Is Do you have liability coverage for that sort of thing?
We do. We have auto liability coverage. Um, I try to make sure that when we're starting to work with someone, a big thing, I'm certainly a big advocate in transparency. We're always going to be transparent with what we can do and what we're not a good fit for. Um, we're not always what I tell people is that it's not a good fit if someone wants to hire us for transportation only. There are other um, services that are available. And this depends on the level of comfort that people have with technology. Ride sharing services like Uber and there's many others um, can be much better than hiring us only for transportation. We also sometimes people hire us and they want to fill the care plan with only with light housekeeping activities. Um, our employees are healthcare workers. They are nursing aides, they have healthcare training. They want to help people with healthcare related activities. They don't want to only be a housekeeper. Um, and so I just try to make sure that people realize, we're healthcare first and some of these other things secondary. So as far as the transportation goes, we often will take our clients to appointments that they may have, doctor's appointments, grocery shopping. Some of our clients like to get out and just go have coffee. Some like to go get their hair done, get their nails done. Um, we help with all of those. We have coverage to address when our caregivers are driving, but we have a fair amount of caregivers that don't drive. And in those cases, we will coordinate the ride sharing transportation like Ubers to get clients to and from appointments.
Okay. You've got a couple more questions, but I think you've already answered them. One of them is that you have full-time and part-time employees, which you talked about. And the other one was about insurance coverage. I think
Sure.
you said it's almost never because it's not health care related. So Medicare and things like that don't cover it. What about long-term care insurance? Does that cover it?
Sure. So I'm going to back up to one of the questions, and then I'll get to long-term care insurance in one sec. There was one about the caregivers, employees of our firm. Yes, they are. They're not contractors. They are actual W-2 employees. So we're withholding any of the payroll taxes that are needed. We also provide any liability coverage if something were to go wrong. Also, we provide coverage if the caregiver were to be injured. One of the biggest risks that could happen if individuals hire privately is that if the caregiver gets hurt, and caregivers do get hurt, sometimes they slip and fall on a sidewalk. Sometimes, if there's assistance with mobility, they may hurt their back. There's a lot of different ways that a caregiver can get injured on the job. Um, and if you're directly hiring someone, you would be liable for the medical bills potentially. You also could be liable for any lost wages. So, because they're our employees, we cover all of that. In addition to much of the vetting that we talked about earlier. Um, the question about insurance. So, I think the easy way is what I mentioned earlier to understand this is we're non-medical support. So healthcare and medical coverage doesn't apply. So Medicare and any healthcare coverage, 99.9% of the time is not going to cover. our services. Medicare considers it custodial care. Sometimes you'll hear it called non-skilled care, but when they're referring to that, it's not covered on a daily basis, on a recurring basis. Long-term care insurance is completely different, and if people have long-term care insurance policies, that can absolutely cover the services that we provide. And, I'm glad someone asked that question because, that's one of the things that our agency with Assisting Hands does, more than I certainly see other agencies do. Um, I want to take as much of the administrative burden off of clients as I possibly can. Um, we can provide assistance with people through the claims process. In the claims process, if you have a long-term care insurance policy, can be a very grueling process, and it also can be very tricky to navigate. Um, we also, once a claim is approved, there's typically a 90-day elimination period where the policy holder is going to have to pay out of pocket. Now, that elimination period could vary. I've seen some as short as 30 days. I've seen some as long as 100 days. But the most common that I see is 90 days. Um, and um, the thing about long-term care insurance is each policy can vary significantly. So it's hard for me to say, here's a hard and fast rule about all long-term care policies because there are minor details that make a huge difference. Sometimes an elimination period could be waived. Sometimes there's different criteria, of course, to to have a claim approved. Um, the way that long-term care policies count the days in an elimination period can vary. Um, so you almost need to look at each individual policy. If you're working with a provider like me, or like a care manager or someone else, they would almost need to see your policy so they can see the specific details in that policy, and they can also see any riders that might have been put in that could make a difference in the policy. And that's something that I'm happy to do. I've got someone on my team that can actually have a phone call a with the individual, and also their insurance company, so we can really get in about an hour's call, we can really get to the bottom of many of the details in the policy, and we can provide a report to that individual about what their policy covers, what it doesn't cover, some of the unique aspects of their policy, so they know exactly how they can use it and what it would apply to. And I'll give you one more example. In some long-term care policies, there's a rider that talks about home modifications that are available. So you could have grab bars installed, you could have a chairlift installed in a home. That would all be covered by a long-term care insurance policy. People don't realize that. Some long-term care policies cover care management. So if you're working with an aging life care manager to help with some of the strategic aspects that you might have to navigate, that could be also covered by a long-term care policy. So many different unique aspects and details, but we can help people with that as they're trying to understand, what does my policy cover, what does it not cover. We can help people through the claims process, but then we also, once the claim's approved and the elimination period is passed and the policy starts to reimburse for the services that we're providing, we take on all of the administrative burden on behalf of someone, because to get reimbursed, the long-term care insurance companies require submissions around the invoices. They require submissions around care notes. Some do, some don't. Some also now are even requiring proof of payment. So we have access to all of that information. And ultimately, we would be able to provide that. We do provide that. I think we have probably around 3 dozen clients right now that we do all of the work around their long-term care, just to take that burden off of the individual and or their family.
Okay, Brett, it's about 10:45, and we had one of our audience members concerned that we might not see the rest of your slides before time runs out. So
Okay.
maybe we could jump back into that and then pick up the Q&A afterwards.
Okay. Um, what I the thing that I want to say is that I don't have too much more as far as the slides go. I told you that there was only probably four, five, six slides, and that was, including maybe the title slide. Some of the things that I hear quite a bit that give home care agencies a bad name. Unfortunately, I find that I'm often pushing against this, but whether it's other professionals that I see or just people out in the community, they tend to sometimes have an unfavorable um, perception of home care agencies. They think that, and these are some of the common complaints I hear: caregivers are inexperienced, untrained, unsupervised, unprofessional. They neglect their clients. They spend too much time on their phone. They'll say that there's no backups when somebody doesn't show. I hear also that, and this is unfortunate that this is the case, but sometimes people will tell me when they're calling to maybe change agencies that the current agency they're working for, caregivers, they've always had a problem of people not showing up, but now they're not even getting a call to know that someone's not coming. Um, so I feel like I'm pushing against this because, I want to elevate the standard of care that people are receiving. And, if I were to experience any of this and I hired an agency to take care of a loved one of mine, that would be unacceptable. So these are all things that, you know, we at Assisting Hands, and there are some other good agencies out there as well, that I know, the owners, they're hands-on, they do a good job with the same things that we're doing. But here are some of the things that, I like to point out that make a difference. And, this I put on this slide, why Assisting Hands, but these are the things that I would look for, regardless of if I'm recommending to a friend of mine here that their parents live in Ohio. These are the things that I try to tell them to look for. Look for an agency that you're going to get accountability from somebody, preferably the owner, because I feel like when we're starting to work with someone, um, you know, I feel accountable to the clients that we're going to see, any commitments that are made, we're going to see that those are adhered to. And I'm involved in all the aspects of the business, from hiring all the way to the clients that we accept, and the other processes that I talked about earlier with long-term care. I make sure that we try to take care of somebody holistically. Um, you want an agency that provides oversight, and these are things that are required by the state of Virginia, where we have to have a care plan, we have to have an RN that provides oversight, we have to do a reassessment every 90 days. I certainly don't like to take credit for the things that we're required to do. I take the opportunity to do more. And we try to see every client at least once a month. There are some clients that tell us, we're good, we love our caregiver, we don't need you to come by, but we want to have a touch point at least once a month. It could be, most of the time we have a nurse or someone on our team, a care manager, go see a client every week or every 2 weeks. um, you want an agency that's going to have professionalism, so responsiveness when you call. um, you want transparency on, most everything that's happening. If there's something that goes wrong, you want transparency to know what happened and how it's going to be resolved. um, and then another thing that we do is we certainly realize that while we can provide excellent caregivers, there's a lot of care needs that we can't necessarily meet, and we have a network of partners that we can help people with. And those are things like home modifications, care management, if there's skilled nursing services or PT or OT. We've got partners that we utilize on a regular basis that we can help connect our clients to. So, you know these are things we do. these are also things that I would recommend if you're looking for a home care agency. You should really focus on these things because you're likely to get reliable service that meets or exceeds your expectations if these are the things that are important to whoever you're working with. So that's it. There's no more slides after this one. If there are any questions about our services or just about anything else in the non-medical care needs arena, I'm happy to take those questions.
Okay, the next question is, do your employees earn paid sick and vacation leave, and do they have medical insurance?
So the right now we do offer medical insurance. We offer medical insurance after a certain period of time. Um, we also offer other benefits like 401k. Certain employees will earn vacation leave and sick leave, but not all of our employees will do that.
How long does it take from an initial phone call to you before you're on board and somebody's coming to provide help, assistance in the home?
Sure. We really try to meet our clients' needs where they are. So sometimes, I mean, I often will get a call from somebody that needs care. If I get a call, right after this meeting at 11 o'clock, and they say they need somebody this evening, we typically can do that. Um, and then on the other end of the spectrum, someone may call and say, we're really just kind of thinking about home care right now. We'd like to get started sometime in the next 2 to 3 weeks. Obviously, we have no problem meeting that. And, we have a little bit more time to plan and whatnot. But from the time that someone calls, it could be a few hours that we can get something in place. And there are some factors that it depends on the care needs for one. So I never make a commitment that we can absolutely in 2 hours we're going to have someone there because it does matter on what are the care needs and how complex are they. Other factors do have an impact. Whether a client has pets or not, that may reduce the number of people that we have. Um, Certain habits like smoking and whatnot could also have an impact. But we almost always can get started within, I'd say, half a day to the following day.
How many clients do you currently have?
So that number fluctuates. We have anywhere, I think from 70 clients to 100 clients at any, one point in time. Um, so there are certainly agencies out there that are much larger than we are. Um, and I've never set out to have growth that was beyond the our capabilities to provide the same level of service that I want to provide. We have steadily grown since we opened back in 2018. Um, but because we work with a lot of short-term people that only need support for a couple weeks to a couple months, it really varies the number of clients that we have.
Can you tell us again what's the geographic area that you guys cover, and are you planning to expand that at any point?
Sure. So the areas that we cover: Arlington, Alexandria, all of Fairfax County. Um, I'm not planning to expand beyond that. There are. I think that's certainly large enough to maintain the growth that I'd like to have, but also, again, kind of to my point a few minutes ago, growth has never really been my objective. Providing the highest quality care services possible has always been what our objective has been. So I feel like we have certainly great areas, in our Northern Virginia community. I personally like to get out and see our clients on a regular basis and our caregivers. I think it's been one of the things that has helped us in a variety of ways. I really feel like when I'm seeing the care that's being provided, I can keep a better pulse on how we're doing. So I don't want to expand my coverage area to a point where it's too large for me to be able to do that. Um, and so that's a very long answer to no. I think we're going to be, at this level for a while. Now I do have another assisting hands office that I refer business to in Loudoun County, and we had one just open within the past couple of months in Prince William County. So there are other assisting hands offices that I work with and I have very good relationships with. I know the standards with which they provide care, and I'm happy to refer to individuals that are in those other areas where we don't cover to those locations, and I would still stay involved just to make sure that everything was going well.
Do the clients provide food for the health aides, or do they bring their own?
So they typically will bring their own food. They'll bring a lunch, a dinner, snacks. We have people working, and usually when we have someone working a 4-hour visit, we're pretty clear with our caregivers that, when you're working those 4 hours, you're working. You shouldn't really be taking many breaks during that time. When we get into an 8-hour, 12-hour visit, and 12 hours are typically the longest that we're going to schedule someone for. I think it's hard to work beyond 12 hours. They certainly get a kind of an informal lunch break. We're always working around the needs of our clients. And so that's stressed with our employees from the very beginning that, you have to work with your client to figure out when is the best time for you to take, 20 minutes, 30 minutes to eat your meal that you bring. And so the one thing that we don't ever want to have our clients feel like is that it's their responsibility to provide lunch or to pay for the lunch if they go somewhere. Sometimes clients do that, and clients are happy to share with their caregiver. Caregivers, in so many cases, I get feedback that your caregiver has become a second member of our family, or another member of our family, and I love to hear things like that because that means we're doing our job. If they value us as much as, and they feel like our caregivers become a member of their family. But I never want someone to feel obligated, that they need to provide meals or pay for that. We're there for the client's needs, not for our own.
Okay, next question is how do you recruit new caregivers?
Um, so the best way that we're recruiting caregivers is when we get referrals from our existing caregivers. Our existing caregivers are people that we constantly evaluate. We're comfortable with them working with the, they still continue to meet the same rule that they met when we hired them. Would we have this person care for our family member? And so we think very highly of the caregivers that we have. And that's the best source of referrals that we get are their family members, their friends, their community members, and we get quite a number of referrals from our caregivers. When we're not hiring that way, we're typically hiring from online job posting boards or other places that have tended to have reliable caregivers. So that's the bulk of what we do. But I'd say our best hires almost always come from a referral from sometimes it's a client, most often it's from other caregivers. And I really like it that way and hope that if I could continue to get more referrals, we pay a referral bonus to caregivers that do refer someone. So we certainly provide an incentive for them to recommend us to their friends and family. But I think most of the time they're very loyal. They really like working for us. We like to, I mentioned that I get out and meet with our caregivers on a regular basis. I do a lot of supervisory visits. That helps to generate some loyalty with our people. And I like to think that they recommend us not because of the referral bonus that we're giving, but because they're happy with where they work and they want to share that with someone else.
I think you addressed this earlier, but let's say you've scheduled somebody to be at a client's house for 8 hours and they finish what it is they're doing in 6 hours, what do they do with the remaining 2 hours?
So there could be days where, and there can be some downtime for sure. So if a caregiver has gone through, assisted the client with all of the activities that they need support with that are part of the care plan, maybe they've done some household items and maybe they are finished. Um, in those cases, we work with them to encourage some engagement with the client. You know, maybe there's something they can do together. Maybe they can look through this. This is this could vary from client to client, but we would promote some sort of engagement with the client to happen during that time. If there was another thing that we do is if we realize that a client's hired us for 8 hours and they're routinely not using the caregiver for that full time, we'll have an honest conversation about maybe you don't need 8 hours, maybe you just need 4 hours, or maybe you need 6 hours, and that could save you some money. And we're happy to do that because I don't want someone to not feel like they're getting the value for their services. Um, and I'd rather get the time, the duration, and the cost at the right level for that person than to continue charging them. So if we notice that that's happening on a regular basis, we'll have a conversation with the client about, trying to make an adjustment. Um, in some cases, if it's an isolated day and they finish early and the client says, "Hey, I'm gonna just read my book for the next hour," you can go home early. Then they'll let the caregiver go home early. Caregiver calls our office and says the client's letting me go. They're not going to be able to clock out. We do everything electronically with the phone, so there's a phone app that the caregivers have to clock in when they get there. They have to clock out. We have parameters on when they can do that, so they can't clock out early. They also can't clock out from another location other than where the client is located. So in order for them to clock out, they're going to have to call our office and say, "Hey, the client's letting me go an hour early." And we'll confirm that is okay with the client, and if so, then they'll be able to go home early.
Does the client pay for that extra hour or
Yeah, we still do charge them because we charge them for what the caregiver was scheduled for and what the caregiver was committed to working.
okay?
And I'm very upfront with people about that. If this happens, it's not something that happens all the time, but it does happen with people. They want to let their caregiver go home early on a Friday, everything's finished, and they may call the office and say, "Hey, I'm letting the person go. It's totally fine." They understand that they're going to be charged for that. Now, if the caregiver has to leave early, maybe there's a family emergency and the caregiver has to leave in the middle of their visit. In that case, we never charge somebody when the caregiver is making the request or initiating what's happened.
All right. Well, we're a little bit past 11. We've got one question from Jean.
I have a question. How much experience do you have with people with low vision, and what services do you provide for them? For example, phone management or some administrative chores, that kind of thing.
Sure, sure. So I think we do have experience with this. We've had a number of clients with macular degeneration. My grandmother that I alluded to, that my mom was a caregiver for, that had advanced dementia. She had macular degeneration. So it's a common thing for us to work with people that have both, a hearing impairment and a vision impairment. We have to handle those on a case by case basis, and it depends on the severity. We rarely get someone that is fully blind, but most often it's a vision impairment that has developed over time. And when we're starting the process, again, I mentioned that we always start every client with an assessment. Um, so when we start with a client, even an urgent one that needs care tonight, we're still going to try to get a nurse there prior to the caregiver starting, so we can assess and develop our care plan. And when we're doing that, we'll make sure that we understand, what sort of challenges that individual has around, because of their vision impairment, and we would factor that into the care plan. And so much for someone that might have a vision impairment, they often have tools and resources that they rely on in their home, and we would make sure that the caregiver understood those and integrated that into the activities that they're helping with.
Okay, thank you.
I'm happy to stay on longer. I don't have another meeting that I have to run off to, so if there are other questions, I'd be happy to answer those questions. One of the things I'll make a couple of offers. If there's anyone that wants to have a follow-up conversation with me just on any individual questions that may pertain to you or someone that you know, I'm happy to have one-off conversations. I also send out on a weekly basis educational materials around aging in place. Wendy gets the materials that I send out. I'm happy to add anybody that wants to receive those to my email list, and you'll get a weekly email from me that highlights some aspect of aging in place. And I find that they're helpful. Last week's flyer was one of the topics that I talked pretty extensively about today, which was the reasons you should hire a licensed agency versus hiring a private individual. And it was a great flyer that, in one page succinctly summarizes, what I probably spent 5 minutes talking about. So that's just one example, but I would love to add as many people that are interested in getting on that email list, so you can receive an email from me every Thursday.
All right. Well, I think we've answered all the questions that have been asked so far. So maybe toss it out there and see if anybody else has a question.
Could he give, Brad, can you give your contact information, telephone or website?
Sure. Let me do this really quickly. I can put it in the chat, or I can email it out. What would be the easiest way, Wendy and
So
Gary?
I'd say right now, put it into the chat.
Okay.
And even after you put it in the chat, you might say it out loud, so it's also on the recording.
I will do that.
And then number 3, if anybody on the call can't grab this information out of the chat, just email the office, and we'll make sure that either we send it to you or we forward it on to Brett.
Okay. So again, the name is Brett Sanders. My direct phone number is 703-639-4380. And then my email address is my initial B, last name Sanders, at assistinghands.com.
Okay, well, Brett, thank you very much. This was wonderful and lots of good information here. Your slides were very, very helpful and very informative. So thank you for joining Coffee and Conversation today.
Thank you for having me, Cheryl.
And so it's already 11:07. So I'm sure you have other folks, the folks here have other places to go. So, but just be reminded that next week you'll learn about getting a good night's sleep, which we all want to know about. And so Cornelia Lesh, who's the manager of community and employee wellness at Virginia Hospital Center, will be our speaker. So if you're having problems getting a good night's sleep, be sure and tune in next week at 10 o'clock. And until then, stay cool. It's going to be hot again in a few days. And we'll look forward to seeing you next week.
All right.
Great, thank you.
Thank you so much for having me.
Everybody.
Have a great
Yep.
day.
Okay.
And Brett, just so you know, we got up to 38 people on the call today.
Great. That's wonderful.
And a lot of comments about how clear you were in your communications with people in terms of, things that are sometimes difficult to understand. There are several comments about appreciating the clarity of your remarks.
Sure, I'm glad that came across. Sometimes these topics can be confusing, and I try not to make them more confusing. I try to make it a little bit easier, but I'm glad that came across. And please have anybody contact me that has questions about non-medical home care, about navigating the process. If it's, again, if it's something that I'm not comfortable answering, I can point them to an aging life care manager or someone else who I'm sure would be able to provide support. So again, I'm so grateful for the time that you guys allowed me today, and it was wonderful being able to meet with your members.
Okay, thanks, Brett. Bye-bye.
Right.
Bye-bye.
See you all next week.